very much. Thank you very much, President. And now we'll move on to the political groups. First of all, Mr. Manfred Weber from the EPP. You have the floor, please.
President Sassoli, President von der Leyen, Minister Zacharias, dear colleagues, you are facing an unbelievable stress test for the European societies, for the European way of life, for all Europeans. No handshake, no visit of grandparents, no holidays, no meeting with colleagues at work, only home office, and always this terrible mask. The big majority of our citizens understand the measures introduced mainly by the member states, by the regions. This is the only way to protect each other. And we have to thank the citizens for their understanding. And we have to thank especially those who are working in the health sector every day. They are the heroes. Everyone wants to escape. And the only chance to do so is vaccination. That is the light at the end of the tunnel. Probably the only light we have currently. And that is the reason for the disappointment. That is the reason today for the huge expectations which we face when we speak with our citizens. To avoid further frustration among citizens, I think the most important thing is to tell the truth. First of all, the demand is much, much bigger than the production. We need time. Second message of truth is, yes, the EU made also mistakes. Not everything was perfect in the last weeks and the last month. And there will be in the next upcoming weeks and months the moment to do here in the Parliament a report about what can we learn out of the developments in the last weeks. And another message of truth is to tell people that a lot of decisions we took together were right decisions. The key decisions were right. First, without the European Union, without our fight for more money for research, there would have been no chance to develop the new forms of vaccines. That was right. It was also right to not make a difference between first and second class Europeans. To keep Europe together was right. It was also right we as lawmakers established the principle of liability rules for companies who are distributing products in Europe. And they also have to be respected from the pharmaceutical companies. The Brits gave up, we as EU not. And fourthly, safety first. Probably it cost a little bit of time, but we didn't do a fast-track procedure on the EMA. We respect our experts to do a proper assessment, and that was right. Dear colleagues, again, not everything went perfect in the last years, but the key decisions were right, together with the governments, together with the Parliament, together with the Commission. I also want to say a personal word to Stella Kyriakidis. She is in the centre of the storm currently as our health commissioner. And I want to underline that she herself and the whole team did a great job for Europe. So thank you so much, Stella, for your work. Und jetzt, was ist jetzt zu tun? Meine sehr verehrten
And, honourable members, what is to be done now? We must be ambitious. It's a time for ambition. My group put forward an 11-point plan yesterday to find ways to speed the process up. We need a multi-billion euro investment plan. We need to ensure that we are prepared for possible mutations and build an alliance across the pharmaceuticals together with the public sector to be strong. We need a summit, talk with the United States and overcome the impasse and the obstacles we still face, and we support cooperation with other states, but without being naive as Europeans. An export ban of European-produced vaccines must remain on the table in our view. The United Kingdom, if the United Kingdom is not willing to deliver doses to Europe, then why should we deliver doses to the United Kingdom? We also need common rules on travel to the European Union. We talked a year ago about common rules within the Schengen area for travel from China. And still today, we're not in a position to come together for common rules for the United States arrivals or South African arrivals, and it's a great shame that we're unable to do this. We still await decisions in this field. We want there to be a certificate, a mutually recognised vaccination certificate. We've got tens of thousands of Europeans receiving vaccinations on a daily basis, and we're still unable to put together a certificate that's recognised Europe-wide. And last but not least, with regard to jobs, colleagues, we gave a green light to the Recovery and Resilience Fund yesterday, reconstruction in Europe, but only 4 member states have taken the decision on the own resources decision, and that is still blocking funding. So there's still some work to be done. I've been speaking to experts in the health sector, and they find themselves in a deep crisis right now. You know, these are people who are rolling up their sleeves to try and do their very best, and we as Europeans should all do the same.
Thank you very much. Thank you very much, President. Now we move on to Madam Irache Garcia Perez from the S&D Group. You have the floor, please, for 4 minutes.
Gracias, Presidente.
Thank you very much, President. Thank you very much, Commissioner President. I understand these are difficult moments, and of course, 1 year fighting against COVID-19, and we all want, as soon as possible, to return to the old normality. But I would like to invite all of you that we stop a moment and pause and think, putting aside all of the different issues that might be, conflicts, internecine strife, put all that aside and look at the interests and look at the legitimate issues. Of course, there are party issues that may be legitimate, but this is not the time. So, fiasco, disaster, catastrophe, these particular messages that have come from those that are frustrated, unfortunately, they ring very true to our citizens. Citizens that are frustrated, that fear, and that are waiting for very much. They're waiting for the European Union to deliver. So for citizens, it is very clear that we're not going to emerge from this crisis alone, and it is absolutely necessary for all to fight together in a spirit of solidarity, all together. So we put aside those Cassandra-type messages that are delivered. We have to put all of that aside, and we have to think clearly, and we have to act responsibly. Of course, criticism is necessary, but with a constructive spirit and with an idea or with the feeling that we will be loyal to this construct. And indeed, what we have to do, what we should have done from the very start, and I'd like to remind you what happened at the beginning of this crisis, of that particular fight that took place between member states concerning masks, basic medical material. I don't think that this is the solution right now. Of course it isn't. Now, with regard to the vaccines, there is a new defense mechanism which has kicked into action in the United States by President Biden. So I think that might be one of the particular solutions. In other words, we move forward looking at the necessity that exists, first of all, to serve our citizens. We need fewer instruments indeed, because the EU, of course, doesn't have as one of its issues of remit health. And for this particular reason, we had to establish new instruments in a record time. We put into action the various new mechanisms for unemployment, the recuperation, the resilience program as well. And all of this, within this environment of pandemic, we've moved forward as far as developing a vaccine in record time. 1 year later, since the beginning of this crisis, we are much closer to the end of the tunnel. We see light, finally, with new services. We're finding solutions in a spirit of solidarity. What happened with AstraZeneca created, of course, great disappointment, but we have found solutions to that problem. And we have to be able to find instruments to put together control mechanisms as well. The Parliament has to do that. We have to have a committee in place where there will be MEPs present, there will be people from the Commission present who will be able to come forward and tell us about what needs to be done on this front. A lot of public money has been invested, millions and millions of euro from the European Union, from the member states as well. A lot of public money has been spent and has been earmarked, and we have to see what is being done with this public money as well. I do feel that it is necessary to move forward effectively to concentrate on establishing consortia between different undertakings in the pharmaceutical industry in order to have an organized production of these vaccines. It is not an individual problem, it is a global problem. We have to have a mechanism for control of exports. We have to have a mechanism as well in order to make sure that there is proper distribution in place of these mechanisms worldwide. 230 million vaccines have been purchased by, or had been purchased by the European Union, whereas and much more was necessary. But we have to understand that there has to be a clear spirit of solidarity. Solidarity between the member states, solidarity at the global as well. So what we have to do is work on this particular front, a concerted effort that we have production which will increase, production of the vaccine, in other words, provide for the European Union, provide for our neighbors, our friends abroad as well. We are in a position to draw important lessons from all of this. This is not the time to sit and cogitate and think too much. We have to draw the lessons, implement what we've learned in order to meet the challenges before us. We have to be more effective, faster. In my political group, the Commission will always find a partner, a constructive partner, with whom one can work effectively in order to overcome this pandemic. Thank you very much. Mr. Ciolus, please. You have the floor. 2.5 minutes. Thank you.
Merci. Madame la Présidente, je vous...
Thank you, Madam President. Thank you for coming to the European Parliament. As you know, my group insisted on conducting this debate. It's very, very difficult at this stage. I have no doubts that the vaccination and the project are affecting the European people during this term, much going beyond the recovery plan, which is a bit of a revolution. This vaccine affects each individual European in what they hold the dearest, their health, their loved ones, and their desire to regain their freedom. It's the first time in history that Europe shoulders such a responsibility vis-à-vis European society in the realm of health. Boris Johnson's attitude gives us an idea of what could have happened in Europe if we just let each individual member state do what they felt was most convenient in facing this challenge in each member state. The European Union has to listen to the citizens and to join in a Europe of health alongside what member states are doing to ensure that the European Union and the Commission have clearly recognized responsibilities in the field of health. But to fully support the collective approach does not mean that we're giving everybody a blank check. It's an opportunity because Europe can't afford to get it wrong. And that's also true of the European Parliament. Each step needs to be justified, explained, and constitute a real solution to the problems at hand. And we need to be aware that we need to explain what we might have done better in the contracts that were negotiated with the vaccine manufacturers. But now, each new challenge must be anticipated, well prepared for, and solutions need to be arrived at. And in the mission that you have entrusted Thierry Breton with, alongside Commissioner Kyriakides, to meet this industrial challenge of production of masks and health in general. This mission must be an opportunity in the medium term, to create a fully independent vaccine production line in Europe, because we can imagine that this kind of challenge isn't going to stop now. Europe will need this capability, not just for research, where progress has been made, but also in terms of production, including industrial production, because thanks to our research efforts, we have a responsibility as the European Union, not just for our own member states, but also for those who live close by, in the Balkans, on the African continent and beyond. Europe must be able to deliver vaccines as soon as possible. We need to continue with the COVAX initiative and work internationally in cooperation that needs to be organized. And also, there's a democratic challenge. We need to be open and transparent each step along the way. And, Madam President, we need to establish, as you've said, this contact group as soon as possible with the European Parliament. We're very pleased here in the Parliament so that each step will be known to this House in good time. We need to be aware of the new challenges and the implementation steps. This proves that it's only through transparency and being open that we can establish confidence amongst our citizens, and today's debate should be part of that process. Thank you.
Presidente Cholos.
Thank you very much, President Cholos. Now, Mr. Zanni, Marco Zanni from the ID Group. You have the floor for 3 minutes, please, sir.
Grazie mille.
Thank you very much. Thank you very much, President. And President von der Leyen, colleagues, I am surprised today. Now, the vaccine campaign was a major challenge, the most important challenge that the European Union has confronted. And the speakers who have taken the floor before me will have spoken about the great work that's been done by the Commission as far as this particular campaign is concerned. There have been promises made. There have been much said about confronting the challenge and the effectiveness of all of this, but it hasn't been that way. And President von der Leyen explained in great detail about what has not taken place, or rather has spoken about the few things that have taken place, but has not said about the many things that have not taken place. We've lost time, a lot of lost ground as well. So I would like to remind you of some of the aspects of this particular campaign that have been a failure, and my country has experienced these failures as well. The citizens, the government, haven't really perceived the gravity of the situation. And what we saw over the last couple of weeks, the huge contrasts and the huge contradictions that emerged between the members of the Commission, between the various institutions as well, something which we haven't seen and which is unprecedented, actually. And the greatest defect of the EU is the inability to correct huge errors that have been made, and the inability to recognize the fact that errors have been made and that poor choices have been made, and poor choices have been made in confronting crises. We've seen this with the crisis of a couple of years ago, the economic crisis, poor management of that, and now we see that with the COVID crisis. So I think there are two issues here. The health which is at stake right now, the health of European citizens. It's absolutely necessary to have a quick campaign initiated and implemented in order to save lives. And something else which is important is, of course, the economy. Now, those who will be vaccinated first will emerge first from the economic crisis as well. And our competitors outside of the European Union, India, China, the United Kingdom, a number of different other entities as well, they're moving forward much more quickly. on this particular front of vaccination, I'd like to say something, Madam von der Leyen, that you recognize, we recognize that everybody makes mistakes, and of course, this is a very, very complex issue, the management of which is very difficult. But the issue is what concrete steps are going to be made to emerge from the quagmire. Now, vaccinating 70% of the population by September, but looking at things right now, we can clearly see that this is an objective which is totally unrealistic. So, with realism right now, what can take place in reality? That is the question. What actually can take place? Because the particular forecast that has been put down by you is totally unrealistic. So, I think it's very important to deliver that. Of course, we have to respect the different players, including the pharmaceutical industry, because they are part of the solution as well, these multinationals. This is a very, very major problem. So I expect realism, objectivity as well, how we're going to be able, once again, to somehow look at the facts, evaluate the facts, and find what the necessary steps that have to be taken, what they will be, and what can actually be achieved in a realistic time frame. That's what we need to know.
Thank you.
Thank you.
And now 3 are already authorized in Europe and more are expected. Indeed, that is a marvelous achievement. However, we must now look at the things that need to be urgently improved. And most importantly, we need to ramp up production. And not just by a little, but by a lot. And yes, that should have been done earlier. And yes, that costs a lot of money. But continuing in and out of lockdowns for months on end will also come at a tremendous cost. And we need to draw the lessons, also when it comes to transparency of the contracts the EU made with those pharma companies, in order to strengthen public trust and allow for democratic control, also of this very parliament, we need to have full transparency of the contracts. And yes, dear Commission, dear colleagues, we also need to be self-critical. This crisis has painfully demonstrated the value of public research and the good public healthcare systems. All areas that have been constantly getting under the bus in an attempt to save money in recent years. Now we see how lethal such an ideology of austerity can be. Let's learn together and invest in our resilience, our social fabric, our public services, education, digitalization. But we also cannot just pay attention to our own well-being. We have a responsibility in the world. While the rich countries are buying up vaccines and are fighting over who gets the doses first, some regions of the world risk of being totally left behind and getting their shots with delays of years. And that is a real catastrophe. Nobody is safe until everyone is safe. And vaccines need to be accessible and affordable. We must do everything in our power to scale up production massively and ensure a just global distribution. And this is possible under WTO rules. And I wish that the European Commission would be more supportive in using those flexibilities. Intellectual property and bureaucratic barriers should not stand in the way of ensuring a more rapid and equal distribution globally. Overcoming the pandemic will unfortunately still take time, and we cannot relax efforts to limit the spread of the virus, especially given the new variants. But reducing cases massively will not happen, though, as long as some liberties are allowed in some EU countries while forbidden in other countries, like ski resorts or shopping centres. It will also not happen as long as testing and tracing efforts remain highly disproportionate across member states. And of course, no one approach will work for everyone, but we will not overcome the pandemic while withdrawing into national egoisms. Yes, the ambition to tackle this crisis together and to deliver the vaccines together ensuring equal access for all EU citizens was and remains the right recipe. And I therefore also urge the Portuguese presidency to continue in this spirit of cooperation and to ensure member states come closer together in implementing common guidelines to contain COVID-19. Thank you.
Grazie.
Thank you. Shidlo, for the Conservative Group, ECR, please.
Mr. President, Madam President of the Commission, dear colleagues, Europeans have put their trust in the EU institutions. They were hoping that there would be an efficient and effective vaccination campaign, meaning that everyone would be entitled to receive the vaccine. And this needs to be ensured because our health is at stake, our future, our economy, and all our common ideas and values. The question is the Commission up to this task? Has the Commission coped? Have you not failed? You were quoting many examples of successful vaccination campaigns. You have quoted Poland, and I can only agree. Yes, the Polish government is doing very well. And it could even vaccinate more Poles. It could even vaccinate more people willing to vaccinate had we had enough vaccines at their disposal, but this is not the case. We do not have enough vaccines. The European Commission has signed a contract on behalf of the member states, including on behalf of Poland. You have taken up this prerogative. You have taken up upon yourself your responsibility for the vaccine, which means that you need to enforce those contracts. On the 8th of February, we were to receive a batch of vaccines. We will receive it a couple of days earlier, and the volume will be smaller by 20%. So there is a delay, and we are receiving fewer doses than promised. What's going to happen in the future? This is the most important task of the European Commission. The contracts need to be respected, need to be enforced. All the member states need to receive the doses that have been ordered. Solidarity matters, but we also need to be efficient and effective. What I see is a lot of words, a lot of empty promises. You do talk about the future. I welcome this idea of creating new groups and new teams, new working groups. But it is all about words. We need efficiency. There is this ritual involving a lot of promises and declaration, expressing our dismay at what the producers are doing. But this is all words. What concrete, specific instruments are you going to use to enforce those contracts that have been signed? You have taken this prerogative away from the member states. Now you need to fulfill this task. You need to fulfill your promises. Thank you.
Thank you. Aubry, on behalf of the GUI Group.
A lei la parola.
Je vais pas y aller par quatre chemins.
I'm not going to beat around the bush, Madam President. I have one crucial question for you today. How could the European Commission accept to just lie down when dealing with the pharma companies? I got the impression, Mrs. von der Leyen, that the big pharma companies took your job over. I think it is a lack of clarity on every step along the way. And following the request from the Parliament, only 3 contracts have been made public thanks to the pressure brought to bear by the citizens. And this is what they look like if you haven't seen them yet. All the information of real importance, such as price, the timetable for deliveries, and even the detail of the liability clauses have been blacked out. For the other contracts, we're going to have to wait for the laboratories to agree to publish, because yes, they decide whether or not they do. And all kinds of delays and no timetable respected. Now on sanctions, don't expect any, because they're in control. They're in charge. And it's the same scandal. These vaccines were developed thanks to billions of public money, millions of euros, but it is the exclusive property of a big pharma. The result, member states can only wait for the massive distribution that is so sorely needed, because the labs are in charge. And 15 billion in profit in sales figures, and 20 to 25% of a benefit margin for Pfizer, who's quite pleased with its success. It's blockbuster, I quote. They didn't come up with the vaccine, but they came up with 400 jobs to be eliminated and more dividends to be generously distributed. Open the champagne bottles because they're in charge. What is the power that we have? Is it not up to us here in this house to make laws? Are we unable? We're able to impose incredible restrictions on our citizens' freedoms, but we're totally unable to impose any kind of rule on Big Pharma. I think it's time to show accountability, which is why on behalf of the left of the European Union, I ask for an immediate committee of inquiry looking into the responsibility within the Commission in this disaster. We have the right to know. After all, these vaccines were paid for with our money, and it should be a straightforward equation. Public money, public contract, patents in the public domain. It's as easy as that. For decades now, we've all just been giving up even our health and handing it over to the private sector, and now we're seeing the dead end that leads to. And the all-powerful laboratories, well, we have to put a stop to these patents, and no profit should be made on this pandemic. That's the only way that we'll be able to quickly vaccinate the entire planet, to ensure that citizens who have doubts coming forward with these multinationals vaccines, hoping after a year of mourning, of concern, precarity, and isolation. That is what we need to act on. If you had not given up vis-à-vis these pharma companies, the population is fed up with the precarity. Young people are in despair. Let's take back control from the labs. Let us deal with the market, and finally, to see these vaccines as humanity's common good and not something for the shareholders to get rich off of. Thank you. The unscribed 1 minute.
Grazie, Presidente. Madame la Présidente, l'Union européenne...
Madam President, the European Union defends the lifting of intellectual property rights on vaccines, but this is the remit of the World Trade Organization. There are two good reasons for this. If you look at the production capacity in the pharma industry across the globe, you need to step up production to the highest possible level so that we can supply doses to the global population, because the health crisis is, of course, a global crisis. There's no point in vaccinating just a portion of the global population. If you look at Article 31 of the relevant documents relating to intellectual property, the clauses are insufficient there. Now, the second very important point was made by Manon. The funding going into vaccine production was public funding principally. So you've got 2.7 billion public funding plus charitable donations. Now, it's simply indefensible to put pump that kind of amount of public money into vaccine development without conditions or strings attached. And now is the time to correct the errors that have been made. If we're going to ensure that through the WTO we're able to lift the intellectual property rights, we can remedy the mistakes. Thank you.
Thank you. Now, the speakers on behalf of the political groups. We start with Peter Liese and on behalf of the PPE group.
Liebe Kolleginnen und Kollegen.
Dear colleagues, I fully understand the frustration, the anger, and the weary feelings that everyone experiences now during the tough measures that are still in place. But as the Chancellor of Germany said recently, the virus sadly has not grown weary and has gathered strength through new mutations. We can see the situation unfolding in Portugal, what happens when you free up the rules too quickly, and it shows just how important it is for us to stick to the rules and to put up protections at national borders. Ms. von der Leyen, Madam Secretary of State, I think we have some major challenges in the form of these new mutant virus strains. We need to protect Europe as a whole, but also look at the regional level to check that we're not seeing these new variants spreading too quickly. On the issue of vaccination, let me just debunk some myths. Everyone keeps saying that Europe was late putting in its order. Well, the fact is that on the BioNTech vaccine, it's actually Pfizer that had the main responsibility, and journalists have widely reported this. Pfizer denied European citizens' rights when to make claims in the event of things going wrong. So, I'd like to see anyone stand up and say, yes, I'm happy for citizens to lose any right or of claims being made against the pharma company in the event of negative effects. And I think, here the Commission really stood up for citizens' rights, and that's beyond reproach, if you ask me. Then a second myth, we keep hearing there wasn't enough money. 2.7 billion keep being mentioned that came from the ESI, but if you look at additional funds that have been pumped in, you get to a figure of 22 billion. So not everything went right, but there's quite a lot of distortion of messages, and the fact remains we need to get through this crisis as a whole, shoulder to shoulder as Europeans, and that must continue to be the case. Thank you.
Now for 2 minutes, Helen Fritzen.
Thank you, President, dear colleagues, and the Commission and the Council. We still are in the midst of a crisis, a very serious crisis, with huge rates of contagion and new mutations. We don't know how the pandemic will develop or when it will stop, but we do have a vaccine, and the vaccine is a hope for humanity. There is no doubt that EU cooperation is decisive, crucial, so that all of our citizens can get access to the vaccine, because it is our common effort that is important for the member states. And we do have a vaccine, but we still are struggling with the problem. I think, for example, Seneca and their delayed deliveries. I'm thinking of the Commission's attempt to use trade and export restrictions as a measure. I think that what the citizens are expecting the most are the vaccines, and we need to insist on 3 demands from the Commission. The Commission must ensure that these contracts are reached, that they are transparent, based on trust. The Commission must ensure the deliveries, increase production, and to support the member states in carrying out the vaccinations. And the Commission needs to take leadership for a common strategy for vaccinations, so that vaccinations can become fair and everyone gets their fair share. It will take some time, but we need to ensure fair access to the vaccine throughout the EU, but also worldwide. Nobody can be left behind. So many people are saying that, and we too need to lend a helping hand to the developing countries in getting access to the vaccine. The vaccine knows no borders. That's why it's so terribly important for the vaccine not be held up at the borders. Now is the time for action. Quick.
Now for 2 minutes, Pascal Canfin.
Madame la Présidente de la Commission.
Madam President of the European Commission, we stand by you when you recall that 27 individual contracts, individual pricing policies, instead of a single European contract, would have made for a far worse situation than the one we see today. We agree with you when you say that in the United Kingdom, fewer British citizens had received a second dose than by comparison within the European Union. So the fact simply is that in Europe we respected the rules, we respected the procedures, and we are giving citizens their second dose to give them full protection. Yes, it is true, more UK citizens have had their first dose, but fewer of them are fully protected through a second dose. Now, we stand by you, but we are also demanding, Madam President. So we've been asking for greater transparency. We welcome the contact and follow-up group that you have announced. We stand by the fact that Stylianides and Thierry Breton will be working hand in hand with the laboratories to produce more, to ramp up production. That's what it's all about. And I don't know whether simply bringing everything into the public domain will give us the technical know-how to produce more. But we do want more transparency on contracts, as has been said, but also on data. Monthly data to be published by vaccination rollout so that we can see where we stand with regard to the objectives that we set ourselves. More than 70% by the summer. If we don't have this information, how do you expect European citizens to know where we stand, where we are on the route to vaccination? Denmark and the South of France have been the only authorities to make this information public so far, and I congratulate them. We need to have this across Europe. Thank you.
Thank you. Now for 2 minutes, Nicolas Bay.
Mes chers collègues,
dear colleagues, major crises show how effective or ineffective any organization is. The flaws during the financial crisis in 2008, during the migration crisis in 2015, and in the health crisis, no anticipation and no coordination between member states. The European Union promised that things would be improved with the vaccine, but they centralized the orders and authorized the vaccines. But all countries that organized outside of the EU are doing better. And 12 million vaccinated, as many as France, Italy, and Spain. Germany, with prudence, ordering above and beyond the European orders. Hungary, accepting the Russian and Chinese vaccines. And Europe and France are bound by the EU. But as always is the case, the failure of technocrats looking for a scapegoat, not just AstraZeneca. Mrs. von der Leyen, you've decided to temporarily close the Northern Irish border with Ireland. And then you opened it, but really quite opening, without really thinking about it much, that conflict. That's something that your Commission has done. Also, the opposition of the European Union vis-à-vis Russia for 7 years, imposing sanctions dealing with the consequences on our agricultural product. And this crisis forces us to ask for Russian aid to get masks from Russia and China. And also with the Sputnik vaccine, we're going to have to beg for it. and the pitiable European. We've seen in Moscow what's happened, but proposing nothing. It's a mixture of ignorance and arrogance, and for Navalny, accepting Sputnik with nothing in return, and to ask for additional sanctions later only makes things even more of a farce, on top of the humiliation. So this delivery is ridiculous. Serial failures. There was no European strategy, and Europeans deserve more than that on top of the health crisis.
Now, Diana Riba-Hiner for a minute and a half.
Gracias, Presidenta.
Thank you very much, President. President von der Leyen, I'd like to begin this particular intervention reminding you of the effort made by the Commission in order to secure distribution of the vaccine to all member states. Of course, many things have not been properly. We have to criticize the lack of transparency that's taken place with regard to dealings with the pharmaceutical industry, and also the data as far as clinical tests is concerned. So solidarity is very important. Empathy is very important as well. And nobody is saved until we're all saved. And that's why the inequality that exists as far as distributing the vaccination throughout the world is not only a health issue, it's an economic, moral, ethical, human rights issue as well. 39 million vaccines in the rich countries, only 25 entities, 25, however, to the poor countries, 25 million to all poor countries. So as you understand, there is a necessity of a global nature. We have to have a more just, a more equal post-COVID world. And that's why we call for a major effort being made as far as COVAX, co-production with the cooperation between the pharmaceutical entities as well, and meeting, of course, in this particular fashion, what has been demanded by the WHO as well. Thank you.
Lundgren.
Now, for a minute and a half, Peter Lundgren.
Thank you. The Swedish government has insisted on leaving the vaccine's fate up to the EU when it comes to authorization and purchase of the vaccine. The EU is responsible for acting on this, and that is a big problem. We can clearly see that now. Countries such as Israel, Canada, and the UK have access from biotech and Pfizer, and we need some declarations. We are told that what we need is the health of the Europe, and that the failure was only because of the free market. It's tragic that the ministers and prime ministers did not get the support when it comes to the vaccination. But the Commission took more and more power, and the negotiation strategy for the purchase of vaccine came too late and not focused on the delivery, but rather on the production. And of course, the vaccine, of course, at the same time, it was the biggest budget agreed, and it was waste. And of course, the pandemic continued unabated, and other recovery and resilience packages to ensure that citizens in Citizen and in Italy can be saved. The Commission needed to realize that it is not ensured safe deliveries, with a high price on the vaccine, leaving many countries behind when it comes to countries being able to vaccinate their citizens. The Swedish Democrats, of course, are prepared to take responsibility for the strategy.
Minuta, Mark Botenga.
For 1 minute, Mark Botenga.
Dank u wel, mevrouw de voorzitter.
Thank you, Madam President. of course, we're dealing with the COVID strategy, but now we have a vaccine. My common sense tells me let's act as quickly as possible to help the people and allow as many companies as possible to produce, sharing their knowledge. Our knowledge should spread faster than the virus, but the big pharma companies refuse to play ball. They are insisting on their intellectual property, but we paid for the vaccine after all. The research in the universities, production, development of the vaccine with European funds. In fact, we took the investment risk to de-risk, as Madam Commissioner referred to it, and yet the companies refused to share. Billions of profit for them, too few vaccines for us. In Belgium, the vaccination strategy is at a standstill because companies are not delivering. And shareholder value costs human lives. Please, let us start sharing this knowledge. Fewer dividends for shareholders, but more vaccines for all of us. No profit on the pandemic. Thank you.
Grazie. Issa al minuto.
Thank you. Now, for 1 minute, Martin Gyongyoshi.
Thank you, Chair. Following the historic establishment of the EU Recovery Fund last year, the EU has received once again a golden opportunity to demonstrate strength and solidarity in fighting an unprecedented crisis by making vaccines available for 27 member states, regardless of whether they are rich or poor, powerful or small. There would have been a double benefit, providing protection for 450 million citizens and demonstrate European unity. But by now it is quite evident that the Commission's management was far from perfect. The announcement of export controls on the vaccine effectively triggered a hard border in Ireland, something which we were trying to avoid for 3 years. And the EU lags behind for whatever reason. Only 3% of our population is vaccinated. How on earth do we want to champion COVAX if we can't even get our own population vaccinated? Even with all the blunders, you're quite right, Madam von der Leyen, it is still better that we have the Commission in the driver's seat. But all those that have faith in the European cooperation are losing hope, and all those that are happy to see it stumble are getting a boost. There are two questions that are arising. What are the lessons learned? Some of that you have answered already, but who is responsible?
Grazie.
I hope to receive an answer to that question. Thank you.
Grazie. Issa al minuto.
Thank you. Now for a minute and a half, Esther de Lange.
Yes, thank you, Madam Chair. And collega's, wij zijn vanochtend naar het
Colleagues, today we have come to the European Parliament for a vaccination debate, and no doubt everybody's frustrated that not everything's going as we wish it would. But of course, there are tens of thousands of nurses in the EU that are going back to work this very morning to ensure that they're prepared for this new mutated version of the virus, which can have major consequences when it comes to the hospital's ability to take in new patients. So we have to stick to it, not give up, as indeed the nurses must. And I'm grateful to the Commission who has made the right steps. I listened very careful.
in Council, and I heard one omission and one understatement of the year. The omission Manfred Weber has already mentioned. It's our external borders. It's unacceptable that one member state has closed off its airspace for Southern American flights, yet you can easily still fly to Madrid and then have free access to the entire European Union. We asked a year ago to fix this and to have a common approach, and we insist on that today. The understatement of the year was, of course, the remark that companies may have underestimated their capacity to produce. Yes, hiccups are normal, and then together we try to fix it, like with Pfizer, and I think we did. But some companies give the impression that they're acting under bad faith. And there the EPP believes that pre-financing that was given upfront to set up production, we should be able to take that away, take it back in case companies don't deliver. And I know I'm over time, but I want to make one important remark when it comes to papier dat heel erg
that what is in writing shows a lot of patience. The Johnson & Johnson vaccine.
Fill and finish is done in the US. We get it back. En ook onze Nederlandse premier Rutte.
And the Dutch Prime Minister, Mr. Rutte, needs a telephone conversation with President Biden. They both should be on their list.
Għal żewġ minuti Eric Andrieu.
For 2 minutes now, Eric Andrieu.
Merci, Madame la Présidente.
Thank you, Madam President. Madam President of the European Commission, Madam Minister. If we want to combat this pandemic and minimise negative impacts on our societies, we know that vaccination is the best tool we have. And I congratulate the Commission on its common approach when it comes to procurement for vaccination doses. We can only congratulate and support you in this endeavour. You showed responsibility by insisting on safe and effective vaccines to be approved by the EMA when difficult and less reliable choices were being made elsewhere. Now we must get on with the job and vaccinate people, the most vulnerable in society. We first of all need to get citizens on board and make sure that there is confidence. We can only have public confidence with transparency, and we must have access to the contracts, see the responsibility and liability clauses in those contracts. I profess my role as the defendant of citizens and constituents, and I call on Commission to hear this call from Parliament. You said, Madam Commissioner, that this vaccination is a worldwide endeavour. So if this is the case, we must urgently get on with the job of producing just as much vaccine as we can. We must ensure that we enforce the contracts and that those contracts are honoured by the pharmaceuticals. We cannot find ourselves in a situation where a lack of production capacity throws a spanner in the works and slows down our vaccination rollout efforts because of logistical problems. Now, even if this process is a very complex one in the pharma industry, we should allow other laboratories to be able to step in and play their part in production, ramp up vaccination production in Europe, on European soil, and show solidarity on an international scene. Because if we want European Union of Health to survive, we'll have to do this.
Thank you. Now for 1 minute, Catalan Share.
Dear colleagues, I strongly support a joint European approach in vaccine procurement. It shields us from toxic divisions and helps smaller member states like my own. But colleagues, we have been calling for transparency of vaccine purchases for half a year now. And it's very good to have a commitment on this. But Madam President, we should have heard this speech last June. It was clear from the very beginning that extra efforts need to be made to increase transparency. And what we heard until now was a lack of clear communication, avoiding parliamentary scrutiny, refusing questions from journalists. In a crisis, it's a recipe for disaster. Uncertainty is everywhere these days, and our citizens expect to have all the information about timelines, production, delivery. What will they get, when and how? And if something goes wrong, they also deserve to know why. Who took the decision to refuse millions of extra doses of the frontrunner vaccines? Who negotiated? Which member states were dragging their feet? We need to know that, because accountability and scrutiny are not unnecessary nagging, but they are the cornerstones of democracy and our number one job as parliamentarians. And we will fulfill this role in the future as well. Thank you very much.
Grazie. Issa għal 3 minuti.
Thank you. For 3 minutes, Jörg Meuthen.
Frau Präsidentin.
President, colleagues, the President of the Commission has spoken about this. She has called this disaster a vaccination strategy. This cowers this chaos, to call it a strategy, is a real ploy indeed. And there is essentially no strategy at all. Disorganization. And this has had terrible consequences. Millions of citizens fear for their health, for their economic existence. So all of these decisions which are being made have to take into consideration this particular issue. I think indeed the issue of vaccination, first of all, there's not enough of it. There's not even enough for the risk groups. Israel, the UK, and the United States are making leaps and strides as far as vaccination, because early on they made sure to get the vaccine, whereas citizens of the EU lag far, far behind, and the member states lag far behind as well. Orders were made too late, too little, and it was all totally insufficient. There are certain vaccinations which are proved to be extremely weak and are not even being used in Switzerland, for example, which have been certified in the European Union. So, indeed, we have to look at these issues. Now, the UK did what it had promised to do, and it has worked very effectively as far as vaccination. It has worked wonderfully without the EU. And even when we look at the Good Friday Agreement, they have adhered to that too, whereas the EU has failed on all of these particular fronts. Now, public pressure as far as exports of the vaccination, this is almost a kind of declaration of bankruptcy to a certain extent, a bankruptcy in financial terms and in political terms as well. There was never a strategy. There continues to be no strategy. As Defense Minister, Madam von der Leyen, you worked totally ineffectively, which had terrible consequences for the ministry and for people in the Federal Army at the time. So lives are being lost with this lack of management, this no strategy policy which exists right now. Millions of citizens feel totally vulnerable and are threatened by this lack of strategy. Do all of us, do Europe a favor and step down, Madam von der Leyen. But it appears that you're not even in your seat right now. You've stepped out of the room. Thank you.
Now, Tilly Metz for 1 minute.
Mesdames les Présidentes,
Madam President, first of all, congratulations on the publication of the third contract. However, the risk of repeating myself, I wouldn't call this transparency when all the key clauses have been blacked out. Why not follow the calls of the Greens to publish the entire contract in line with the treaties? That would place you on the side of the citizens. There's so much uncertainty and criticism levelled at the European Union on such an important issue. I simply can't understand why you still remain on the side of industry. And the same goes for the contract clauses. The Commission and Council, why do they place such confidence in industry, and yet they are unable to meet their production targets? And there are so many unanswered questions out here. It's clear that the industry is playing a game that's nothing to do with serving the public interest. Now, I'm sure that the European Union is trying its best, but you have to prove it to citizens, and transparency will be the key here.
grazie issa al minuta u nofs Dirk-Jan Epping.
Thank you. Now for 1.5 minutes, Dirk-Jan Epping.
Mrs. von der Leyen, during your State of the Union, you made an appeal for a health union, And the first misstep was the purchase of the vaccines. It was to be done in solidarity, only through the EU. It sounded like wir schaffen das. But countries such as Israel, the US, and the United Kingdom opted in. The EU cannot escape that 3 months were wasted away. The programs are suffering delays everywhere, and thus more people suffer. You are politically responsible. I've been working for 7 years in the Commission. It's a policy maker, not a deal maker when it comes to the free medicines market. And as a consequence, you gave orders for an export ban, creating a hard border between Northern Ireland and Ireland. Very silly, as you self said. And as President, other commissioners are being blamed. I did not vote for your candidacy of the European Commission because I knew of your past as a Minister of Defense in Germany. Such problems in the purchase and the lack of collegiality. So, von der Leyen, you've run away, but I'll say it anyway. You are to be blamed. Therefore, I make an appeal to you to step down as President of the European Commission. Thank you.
Grazie. Issa al minuta Katarina Konečná.
Thank you. Now for 1 minute, Katarina Konečná.
Děkuji, paní předsedající, vážená paní předsedkyně komise.
Thank you very much indeed. Madam President of the European Commission, colleagues. In the time that's passed since our last debate on this issue, the situation has not improved significantly. We have seen further approvals of vaccines, but the situation hasn't improved. The AstraZeneca contract has not been fulfilled, and we are now in their hands. How can it be that the European Commission can enter into an agreement without any mechanisms for sanctions and in the event of breach of contract? In a normal any other situation, it would be the government taking responsibility, but Commission acts as though nothing had happened, and this isn't the only blunder when it comes to the contract situation. We talk about the restriction on ban on exports of vaccinations, even in the event of humanitarian aid. And at the same time, we say we want to help developing countries. How can we bring the two together? Will we violate our own export restrictions in order to save lives?
The third wave is now almost here in Greece. Everything has been closed. Schools, stores, the system is completely in a state of deep freeze. We need indeed to nationalize the private sector entities which can help us emerge from this situation. Numerous different governments which presented the vaccination as a panacea, that has proved to not be the case. Whatsoever, the health system is in shambles in numerous different countries, and many have found themselves in an extremely difficult situation right now. This is a situation which undermines, of course, mass vaccination, and the terrible delays in the delivery of vaccination has led to a war, has led to conflict between entities and the pharmaceutical industry, and also between undertakings within the pharmaceutical industry. The needs of the public in the end are not being met. We have to have distribution, supply of vaccination from any source that might be able to provide a certified vaccination. Thank you.